Hey, I'm Jason Posner from Boca Raton, Florida, and I'm here with my really good friends, Bill Adams from Dallas, Barry DiBernardo from New Jersey, and Lou Scafuri from Southern California. We're here to look at this device called Sofwave, which both Barry and I have had for probably about 8 months now. Yes. And Lou is the CEO of Sofwaves, and Bill is just learning about this.
So I don't know anything about it.
We're gonna take you through this. Bill, by the end of this couple of minutes, you're gonna steal this one and take it to your spa down the street, and you're not gonna let it go from the studio. You know, each device sort of has a classification and where it fits in our practice. So this, to start with, is this ultrasound. Okay, so there were other ultrasounds prior to this, but you know, we got our previous one 11 years ago. So things have changed in 11 years. So they've upgraded and have proprietary technology. Right. So this is ultrasound, so right?
And what's it?
Ultrasound. Okay, it's got 7 transducers here. Okay,
so that's big.
What's the correct patient for this?
So if your patient is, you know, late 30s to early 50s, that's the sweet spot for this. Doesn't mean you can't use it older.
Patients, certainly.
Younger patients, that's your sweet spot, but we do older patients also. We did me, and
I've had like 2.
And I'll probably, with that group, probably do 2 treatments.
And this is non-invasive. This does not break the skin, and the procedure is quick. But that's the beauty of it, having, you know, non-invasive things in your practice that add to the patient's results and have a great patient experience.
What does quick mean?
Quick, about 30 minutes,
30
I said.
minutes.
Yeah.
And we know previous treatments might have taken us an hour, hour and a half. You will not get an ROI. You will not get a return if you're in a room for an hour and a half. Right. 30 minutes in and out.
And the thing is, look, I did the first bunch of these in the practice, but personally, I probably haven't touched this for 6 months because we delegated. You know, and I think that's pretty much similar to a lot of procedures in our practice that we get that are non-invasive. The surgeon gets it to try it. They do their wives, they do their family members, they do a couple of staff, and they're like, okay, this is great. Now my nurse is going to do this. And as it's ultrasound, there's very few rules across the U.S. as to who can do this.
Let me ask you one other question, because I think people remember ultrasound, this sort of thing. I mean, it did hurt a lot. It hurt like it was crazy. So why does this not hurt?
But let's clarify that's not focused ultrasound.
Okay.
Okay, so there are 7 beams that are independent. It's a beam array of low divergent ultrasound. So what that means is, by looking at the unique transducer plane that we have here, this is not a circle. It's not like a little pinpoint that you have with other ultrasound devices. The energy is distributed across the transducer plane and targeting one specific area of the mid-dermis. And what's also unique, and you can feel this as well, Dr. Adams, is it's cooled.
Yeah.
So we're cooling, we eliminate the scatter, and we deposit very high levels of energy right into the mid-dermis.
That's a pulse.
As well.
Do you feel anything? You're tighter. Look, you
No,
look
I
so
didn't feel a
good.
thing.
Okay, so that was at the lowest setting.
better?
That was at the lowest setting.
Man, look.
Now watch this now. Okay, I'm going to turn it up just a little bit. I'm going to treat like an adjacent area, and it's a 5-second pulse.
Which is part of the key as well, delivering the pulse over time.
Yeah, I mean, it's almost imperceptible.
That's correct. And Lou said a lot of important things in that, which I just want to repeat. So one, and I want to give analogies so people exactly know what we're talking about. So if you take a magnifying glass with the sun to try to burn the piece of paper, you focus to get the heat. So this is a little defocus, so it's not that, which gives you a broader band. And the area being treated, what we were used to in the past were these little pinpoints. These are like cylindrical cones, so it's a much larger area, but it's not only one, it's 7 of them together. So with every time he's pressing that, you're getting quite a large area that's being treated because of the cooling. This has cooling there, and we're hitting the mid-dermis, 1.5 millimeters, sweet spot for where we want to tighten at 60 to 70 degrees centigrade, which that's a very high temperature.
This is not volumetric heating like an RF device externally where you're just heating the tissue to a certain degree. This is creating these little focal points of denatured collagen at 1.5 millimeters down. Now we can turn it up and make it a little spicy, but certainly we have the way to treat patients at a lower setting or a higher setting, and maybe they need more pulses or another treatment at a lower setting, but certainly if they can tolerate a higher setting, you know, they'll probably have less number of treatments. So we've played with both of that, but certainly this is easy. Like if you had this done, you'd be falling asleep, right?
Right.
What we've done lately, and I did it myself. We just put a light layer of numbing on there.
And sometimes what I'll do is take my Zimmer chiller and just focus it on the other side of me. That cool distraction really also does a great job of kind of confusing your nerve endings.
But you can also play that internally because you have a setting for post-cooling, 1 second. If you can go to 2 seconds, you can adjust the internal cooling to balance that also. But what we found is just turn it up, put a little numbing, and just
And as we said, this is a delegatable procedure in your practice. So this is we find it both very safe, so that you have your IS spa. You probably do 2 treatments and say, okay, girls, this is for you guys to do in the spa while I'm in surgery, and you know that it's a safe procedure. It doesn't hurt. You can't get into trouble with this. It doesn't go deep enough to cause any nerve injury. It doesn't go deep enough to cause any fat atrophy, which you saw in some of the other devices. So I think it's a very easy procedure to integrate into your spa. You can have this up and running in 30 minutes in your spa, treating patients the next day. It's not a huge learning curve. And that's sort of what makes this an effective device in our practice from a use perspective and an ROI perspective. Device is not a fortune. It's not a fortune to run the device. Each treatment we're charging, I mean, some areas I heard in the US they're charging $4,500 a treatment. Yes. Okay, for 1 treatment. And that probably in terms of number of pulses would probably cost you maybe $300.
Approximately.
Something like that. So that's a great ROI for your practice.
How many treatments do you typically do? When does the patient see the result?
Right, that's a great question. So this is mainly at the higher settings, 1 treatment most likely. Maybe at the lower settings you might need 2 treatments, and maybe the price would come down a little bit if you know in advance you're going to treat the patients twice. Right. It probably takes a few months to see the final results, but I think you can expect to see results within a few weeks of this. Okay. People do walk off the table with a little bit of improvement, but any of these collagen remodeling devices do take a couple of weeks to months to see the final results.
So I was gonna ask, go back to, you were starting to get into it, the profitability of it, because I'm sure that's what people want to know. So just put the numbers in there. You said them already, but let's just repeat it. Say you get a $3,000, the cost of running it's about $300, so you have a 90% is your return, and you have to put time in there. So if it's taking 30, 40 minutes, say you do 1 an hour, so you're making about $2,500 in that hour, and you're not doing it. Someone else is. That's a tremendous ROI.
Go back to that. So I think the sweet spot for me in the practice is at 10% product cost. So $3,000 costs you $300. That's the right numbers that seem to work in the practice. If you're doing an injectable and it costs you're charging the patient $1,000, it costs you $400, and you have to pay the PA or nurse practitioner to do it, right. Your profit is $200.
We talked about that last night. You don't have that margin.
Right. This has margins for your practice.
And the patients like the treatment.
Patients like the treatment. And the thing is, who are you going to sell this to? That's like, who's coming in the door? To me, this is your toxin filler patients. They're coming in, they're like, we have something that's non-invasive, it works. One to 2 treatments, you're going to see results. Come in your tennis clothes, you're not red, you can go to dinner that night. I mean, these are all check, 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 check that makes it a profitable, effective procedure in your practice from a money-making standpoint.